So we've just been called to a patient who has fallen 2 meters from a tree. Their chief complaint is an angulated right ankle and a large laceration to the left forearm. So we've put on our PPE gear, we've got gloves, glasses and our uniform on, and we've checked for any hazards. There's no angry bystanders, no pets, no branches in the way, and we have located our nearest exit. Are you happy to go on?
Yeah.
Hello, we're the paramedics. What's your name?
Tara.
Okay, and what's happened today?
I think I fell out of the tree or something.
Okay, so my patient is talking to me, so I know there's no obstruction to the airway. Are you breathing okay?
Yes.
Yep. Alright, I'm just going to check your pulse, your radial pulse. Okay, so I'm just going to get my partner to do some vitals. So the vitals I want you to do are SpO2, respiratory rate, blood pressure, temp and BGL. Is that alright with you? Yep. So I can see my patient has a laceration to the arm, so we're just going to deal with this first, exposing the wound and removing any clothing in the way. Now we want to clean the wound out, removing any debris. We need to get a combine dressing, fold it up to the smallest surface area, and in this case the wound is about 15 centimeters long. Hold that on there, applying pressure and wrapping the band-aid around. If the bleeding still didn't stop, we could apply a second bandage. Again, wrapping it around tightly and twisting directly over the wound. Now we want to elevate the arm, and if the bleeding still didn't stop, this is when we could apply a tourniquet. So to apply a tourniquet, we want to apply it 10 centimeters from the wound. Is it okay if I put this on you? And we don't want to put it on the joint, we want to put it on the single bone. So this is going to go on your arm and it's not going to come off until we get to the hospital. And we want to record the time that is put on. Can you tell me what the time is?
8:30.
So we'll record that on the tourniquet. And we twist this up as tight as we can. I'm just going to check that she has a pulse. Nope, that's good. That means the circulation is cut off and the bleeding will stop. And we could apply a second tourniquet if the bleeding still hadn't stopped, which we would apply proximal to the first one. So on a scale of 1 to 10, can you tell me how much pain you're in?
About a 9.
9, okay. So I'm going to call for backup. So AUT1 to comms. I need an extra ambulance with a paramedic or an ICP so my patient can have morphine. And in the meantime, until they get here, I'm going to give my patient some methoxy. So we want to check that we've got the right drug. Yep, it's methoxy. The right date, 9/20, that's 2020, that's good. And we've got 3 mils to give my patient, which is fine. The adult dose is 6 mil. So I'll just get my partner to check the date and the drug. So methoxy may cause a little bit of nausea and dizziness, but it's going to help with the pain. Is that okay? Yep. So we want to check the contradictions. Have you ever heard of malignant hypothermia?
No.
So no one in your family has that? Nope. And do you have any renal impairments? Nope. And so you've never had methoxy before?
No.
Nope. So you haven't had it in the last week. That's good. And she's obeying my command so she can have it. Can you read the date back to me?
The 9th, 2020.
Yep. Sweet.
And methoxy.
So this is administered by breathing it in. So I need you to take deep breaths in and out for me, okay? So the vitals my partner has taken suggest that our patient could be going into mild shock. So For a patient going into shock, we want to keep her as warm as possible. So I'm going to put this blanket on her, avoiding any other injury she has. We also want to give her some oxygen, which I'm going to give to her through the nasal prongs. We want to turn the oxygen on and put it to a flow rate of 3. And the nasal prongs would just go in her nose and over the back of her ears there. So I'm just going to do a trauma sweep with my patient to check for any unknown injuries. So is that okay with you? Yeah. I'm just going to remove the blanket while I do this. Right. So I'm going to start at the top and work my way down. Just tell me if you feel any pain, okay? Your neck. And can you feel this when I'm touching your face? Okay. Just going to feel down, shoulders. Any pain? No blood, that's good. I'm just going to work our way down the abdomen. Can you breathe in and out for me? Equal chest rise, that's good. No blood. Pelvic area. Down the legs. Looking for blood, there's no blood, that's good. It's all down there? Yeah, okay. Alright, so since my patient has complained of neck pain, we may need to apply a collar. To check if she needs the collar, we're going to follow the nexus rule, which suggests that if the patient has midline C-spine tenderness, levels of intoxication, altered mental state, neurological defect present, which could be tingling in the limbs or distracting injuries present, then the collar needs to be applied. So we're going to apply the collar. I'm going to get my offsider to hold the patient's head in place. So to measure the size that the collar needs to be, we want to measure from the mandible to the clavicle and measure that against the collar. Yep, that's right. So I'm just going to get you to slightly lift her head while I slip this underneath. This is a little bit uncomfortable, but are you okay? Yep. I'm just going to manage the pain in the ankle, and I'm just getting my partner to set up the splint for me while I look at the leg. Are you alright? How's your pain on a 1 to 10 right now?
About a 5.
Okay, so that's good. The methoxy's working. Now, we want to check for loss of function. I'm just going to remove your socks. Is that alright? There's no unusual movements. We can see a bit of swelling and deformity. It's a little bit irregular compared to the other leg. So I just want you to wiggle your toes for me and both feet. Yeah, that's good. Now I'm just going to check her capillary refill time on each toe. So compare that. So the good foot is 2 seconds, and on this one it's 4 seconds. And can you feel me touching your feet? Yeah, okay. Right, we're just going to apply the split. So we're going to lift up your leg above and below the wound. I want you to take deep breaths of the methoxy while we do this, okay? Okay, are you ready? Deep breaths for me. So now I'm just going to monitor my patient and keep her warm until back up arrives.
Bingo.
listen to the volume and clarity of air intake. So we're going to use the stethoscope at the base and the apex of each lungs, and I'm going to listen in each position for a full respiratory cycle. Okay, so I'm just going to move your clothing out of the way. Is that all right? You take a deep breath in. Cool, so I was listening for any abnormal sounds such as wheezes and crackles, and there wasn't any. Tara's lungs filled equally and sounded clear. Hi Santana, so I'm just going to take your blood pressure, is that alright? Yep. So to do this, I'm just going to remove any clothing that's in the way. I'm going to attach the blood pressure cuff to your arm, pump it up until I can hear no sound, and then I'll give the bulb one more pump. So it might get a little tight, but that's normal. So the first sound that I hear, I will record that as your systolic pressure, and exactly as I hear no sound, I will then record that as your diastolic pressure. Right, so I'm just going to attach this. And I am using the stethoscope to listen to the pulse on the brachial artery. Cool, so Santana's ranges were well within the normal ranges, the systolic being 100 to 140 and diastolic being 60 to 90. And if she was above these ranges, she would be hypotensive, and if she was below these ranges, she would be hypotensive. Or respiratory rate, is that okay with you?
Yeah.
Yep. So to take someone's respiratory rate, we're going to watch for the chest and abdomen rise for 15 seconds, and we would then multiply that by 4 to get their breaths per minute. So usually we wouldn't tell the patient we were doing this, as this may affect how they breathe. They may breathe faster or more slowly. So now I'm just going to look and see how she breathes for 15 seconds. And Tara's breaths per minute fell well within the normal ranges of 12 to 20 breaths per minute. So I'm just going to take your heart rate, is that okay with you?
Yeah, it's okay.
So to do this, we just feel for the radial pulse, which is located just below the thumb here. So I'm going to feel for 15 seconds, and then we will multiply this by 4 to get the beats per minute. So while feeling the pulse, I'm feeling for the strength, rate and regularity. So Josie's pulse was regular, and it fell well within the normal ranges of 60 to 100 beats per minute.